Dr. Goh Wing-man, Dr. Edgar Zhang, Dr. Constance Chen, ladies and gentlemen, good morning. Happy New Year to all of you. And it's so nice to come to the central government's office without any roadblocks. On behalf of the Chinese University of Hong Kong, I'd like to extend our very warm welcome and heartfelt gratitude for coming to this morning's inaugural conference of CUHK Center for Bioethics. The conference is organized in collaboration with the Hastings Center with the support of the Central Policy Unit of the Government of Hong Kong SAR region. I would in particular like to thank Dr. Goh Wing-man, Secretary for Food and Health, for gracing us with his presence as our guest of honor in his very busy schedule. Also heartfelt gratitude to Dr. Edgar Zhang, the Senior Advisor to Chinese University of Hong Kong's Council, for his foresight and contribution in helping our Faculty of Medicine and the University to build our capacity in bioethics education and research. I can tell you Dr. Zhang has really put his heart and soul and his money into the establishment of this center. Today's conference is the first international conference organized by the CUHK Center for Bioethics in commemoration of the official launching of our center. It is a very important theme of addressing ethical dimensions of policy for aging and genetics. So today in our audience, we have all the experts of geriatrics and on the social and the medical aspects in our audience. As we know, physicians and other healthcare professionals have to face many dilemmas and problems and making difficult decisions regarding the well-being of our patients, and many of them are of the senior citizens' age, all the time, every day in our daily practice. So today's meeting will address some of these dilemmas. And I would also like to say that the opening of this conference gives great pleasure for us to launch the CUHK Center for Bioethics. This center is really a multidisciplinary platform in Hong Kong for the promotion of education in bioethics, both for the healthcare professional as well as for the public, and the promotion of research in this area. I must say that we all feel that Hong Kong is very advanced in our research and education on various fronts in science. However, we have not done enough in bioethics, and it is the time for us to reflect upon this and catch up on what we were lagging behind. And CUHK will get off ground by reforming our curriculum in bioethics in the Faculty of Medicine into a more structured and systematic course in bioethics. The Dean of Medicine told me that bioethics will be taught from year 1 to year 6 in the medical curriculum. And we hope that the education of bioethics is not only confined to the medical field, but also to other faculties, including law, social science, and all other disciplines in our university. But in the medical faculty, the curriculum will start this year in 2015 for all our students in medicine, nursing, pharmacy, public health, as well as in Chinese medicine. In conjunction with this, the introduction of a series of public education programs in bioethics will also be launched so that our public will also be educated on in this area. And to make this program a success, we need the concerted effort from the government, from our policymakers, the academics, researchers, medical professionals, and various NGOs, as well as industry support. On the research front, through active dialogues and scholarly exchange with international renowned institutes in bioethics, including, of course, the Hastings Center, the EFOX Center of University of Oxford, the National University of Singapore, our Center for Bioethics will continue to seek more international collaboration on education and research in bioethics. On this note, I would like to once again convey my heartfelt gratitude to the working group of CUHK Center for Bioethics for the great effort in making the center a reality and for the extra efforts in organizing this wonderful international conference in partnership with the Hastings Center. And once again, thank you very much, Dr. Edgar Deng. And I would also like to thank the Central Policy Unit of the government for allowing us to use this beautiful venue. Have a fruitful 2 days meeting and Happy New Year. Thank you.
Thank you, Professor Song. Please be seated.
Professor Joseph Song, Dr. Edgar Deng, Professor Joseph Lau, distinguished guests and colleagues. Good morning, and it gives me great pleasure joining you this morning at the launch conference of the CUHK Center for Bioethics. And I also like to join the President in welcoming all of you to the Central Government Office at Tamar. Let me start by firstly congratulating the CUHK for the establishment of the Center for Bioethics, which will certainly play a key role in research, public education, and community-wide dialogue in the field. With growing demand and expectation from the public on the healthcare system, the discussion on bioethics is increasingly important in the daily operation, planning, as well as resource allocation within the system. It is even more important when we are contemplating novel medical procedures with social and legal dilemmas and implications. How a society handles such issues reflect the cultural and societal values of its people, and consensus could only be reached through an educational and evolutionary process in the community. It is often too common that new procedures have proliferated and caused widespread confusion before such ethical controversies were addressed adequately and redressed through the establishment of principles, guidelines, regulation, or even legislation. One of the major objectives of the newly established center is to provide an independent and neutral forum to stimulate interest and discussion in the medical and academic sectors, as well as in the wider community, so that these emotionally charged and politically sensitive issues were tackled in a proactive manner. This will also allow the discussion and debate to be conducted in a more rational and objective platform and environment of an academic institution. This dialogue will provide useful reference to the medical sector for the formulation of professional and operational guidelines, as well as informing government's work in developing the healthcare system and establishing relevant healthcare policies. With a special focus on the themes of aging and genetics, the launch conference will cover pertinent issues that are of concern not only to Hong Kong but also the global healthcare sector. Whilst we have always prided ourselves over the efficient healthcare system locally that provide services which is equitable, affordable, and accessible to all, and our life expectancy currently tops the league. It comes along with challenges which our frontline healthcare workers are facing, including how to grapple with the healthy workload and yet be able to provide patients with good quality care, how to accord different priorities to competing patient demand with limited resources, and clinical decisions surrounding end-of-life care, etc. On the other hand, advance in medical technology has empowered scientists and medical practitioners with means to effectively diagnose or even predict the occurrence of genetically based diseases, manage and treat diseases which hitherto have no cure, and even bring about or design specific desirable traits for newborn babies beforehand. Yet, this powerful intervention, if freely allowed, often lead to highly confusing and controversial outcomes, even in the most open and liberal society. In this regard, the Launch Conference has brought together the most eminent speakers and experts to address many of these issues relevant to our aging society and elderly care, as well as those related to advance in genetics and molecular technology. Whilst culture and values necessarily differ between Hong Kong and the rest of the world, we certainly can benefit from your international experience and best practice, and not least, how the process of deliberation and debate could be structured to generate best outcome in terms of aligning values and establishing consensus in the community to facilitate policy development. I wish the conference every success and thank the CUHK once again for its most invaluable contribution to this area of healthcare policy agenda. Thank you very much.
May I now please invite Professor Joseph Sung onto the stage to present a certificate as a token for appreciation. Thank you. So can we take a group photo with everyone or with all the audience?